What if the test your doctor says you need is the very thing putting your health at risk? After 70, some routine checkups could do more harm than good, and no one's telling you. Today, we're revealing the 5 most dangerous ones and what to do instead. Have you ever left a doctor's office thinking, well, at least I'm being proactive? You got your checkup. You followed the advice. You did the scan. But what if I told you that some of these routine tests, the ones we've come to trust, could actually be doing more harm than good? It's not something you'll hear on the radio. It's not printed on clinic brochures, but buried deep in medical journals and overlooked by many practitioners lies a surprising truth. After age 70, certain health checkups might not be protecting you. They might be putting you at risk. Let me share something that might shock you. According to recent studies, up to 37% of medical tests done on older adults lead to unnecessary treatments, serious complications, or lifelong side effects. Even more alarming, 99% of people over 70 have no idea they're being over-tested. That means most of us are walking into these procedures thinking we're staying healthy, but instead, we might be stepping into a cycle of fear, overdiagnosis, and harmful interventions. And here's a number that really made me pause. There's one test, just one, that is responsible for 5% of all cancer cases in the United States. That's the same level of risk as drinking alcohol every single day. Now I know this might feel a little unsettling. You might be thinking, wait, isn't more testing better? That's exactly what I used to believe. But as we age, the balance shifts. The very tools meant to protect us can start turning into triggers for invasive procedures. Things like surgeries, biopsies, or medications with serious side effects, especially when there's no clear symptom or urgent reason behind the test. So in today's video, we're pulling back the curtain. We're talking about 5 common health checkups you might want to skip after 70 and what the science really says about their risks versus rewards. But before we dive in, I want to hear from you. Where are you watching from? How old are you? And have you ever regretted a test or treatment you later found out wasn't necessary? Leave a comment below. We read every single one. And who knows? Your story might help someone else avoid the same mistake. Hit that like button if you care about smarter health decisions. And don't forget to subscribe, because what you don't know could hurt you. And what you learn today might just save you from an unnecessary procedure tomorrow. Let's start with one of the most common tests seniors are encouraged to get, the bone density scan, also known as the DEXA scan. At first glance, it sounds harmless, right? A quick scan, no needles, no pain, and you walk out knowing whether your bones are at risk of fractures. But here's the part nobody tells you. Past the age of 70, this test might cause more harm than good, not because of the scan itself, but because of what often comes next. You see, the DEXA scan measures bone density to help detect osteoporosis. And for younger adults or people with specific risk factors, it's a useful tool. But as we get older, some bone loss is entirely natural, just like getting wrinkles or gray hair. That doesn't automatically mean your bones are brittle or dangerous. Yet, time and time again, seniors are told, your bone density is low, and are immediately started on powerful medications like bisphosphonates. These drugs are meant to strengthen bones, but the side effects can be severe, and in many cases, unnecessary. We're talking about jaw necrosis, yes, parts of your jawbone actually dying, esophageal inflammation, and digestive issues that can make daily life miserable. And here's the kicker. In a major study of over 1,200 women over 70, researchers found that bisphosphonates reduced fracture risk by just 0.3% after 5 years. That's a tiny benefit, especially when compared to the risks. Let me tell you about Rose, a 76-year-old retired piano teacher. She had never fallen, no bone pain, walked every day. She was active and independent. But after a routine DEXA scan showed a diagnosis of osteopenia, which isn't even osteoporosis, her doctor prescribed alendronate, a common bisphosphonate. Within 3 months, Rose developed severe reflux and jaw pain. She stopped playing piano because it hurt too much to sit upright. When we saw her, she was afraid she'd never feel normal again. We stopped the medication and helped her shift focus to what actually works. She began light strength training, added vitamin D, and made small but powerful changes to her diet: sardines, leafy greens, and calcium-rich foods. A year later, Rose was not only back to playing piano, she had stronger legs, better balance, and hadn't had a single fall or fracture. So here's the takeaway. If you're over 70 and haven't had falls or fractures, a bone scan might not be your best next step. In fact, it might scare you into taking medications you don't really need. What's better? Proven, safe options: resistance training, daily walks, balance exercises, and correcting vitamin D deficiency. These changes have been shown to reduce fractures by over 20%. That's real prevention. So next time someone recommends a scan just because it's routine, pause and ask, what happens after the scan? If the answer includes medications with side effects and minimal benefits, it might be time to say, let's try lifestyle first. Now let's talk about a test that feels urgent for so many of us: the brain MR, especially when memory starts slipping. You forget a name, misplace your keys, walk into a room and can't remember why. Naturally, a little voice inside whispers, could it be dementia? That fear, that terrifying what if, is powerful. And doctors, wanting to reassure or rule things out, often respond by ordering a brain MRI. But here's where things get tricky. Most MR is in people over 70 don't reveal a fixable problem. Instead, they often show what's called white matter changes, tiny spots that are part of normal aging. Think of them like gray hairs on the inside of your brain. They're completely common. But the moment we see them on a scan, it can send people and doctors into a spiral of more tests, more fear, and sometimes even surgery. A 2021 study looked at over 3,000 MRI scans from adults aged 70 to 85 who reported mild memory issues. 86% showed some kind of brain abnormality, but only 3% were linked to anything treatable. That means 97% of people went through the emotional roller coaster of hearing something looks off, when in fact, it didn't mean anything dangerous at all. Let me introduce you to George, a 74-year-old retired engineer. Sharp as a tack, but lately he'd been forgetting where he left his glasses and occasionally blanked on old friends' names. His doctor ordered an MRI. It came back with those white matter spots. George panicked. He stopped driving, pulled back from church. He told us he felt like his life was shrinking before the disease had even started. But when we tested his memory with a simple cognitive screening, George scored completely normal. We explained those MRI results were just age-related, not signs of Alzheimer's. We focused instead on sleep, hydration, and daily brain exercises like puzzles and word games. Within a few months, George was back to his routines, more confident and clear-headed. So here's the big idea. Unless someone is having serious neurological symptoms like seizures, sudden personality changes, or rapid cognitive decline, a brain MRI may do more harm than good for mild memory complaints. A smarter first step? A paper-based cognitive screening test. It's simple, low cost, doesn't involve any machines, and gives a clear sense of whether there's something to worry about. Memory changes can be scary, but sometimes the most powerful tool isn't a scan, it's understanding what's normal and taking small, smart steps to stay sharp. Now let's talk about your heart and the test that's supposed to protect it, the cardiac stress test. If you've ever mentioned to your doctor that you're feeling more tired lately, maybe a little short of breath on a walk, chances are they brought up a stress test. It sounds logical. After all, heart disease is the #1 killer in America. Why not check if your arteries are blocked? But here's the surprising truth. For people over 70, especially those without classic heart symptoms, the cardiac stress test can actually do more harm than good. Why? Because it's incredibly prone to false alarms. In fact, studies show that up to 40% of stress tests in older adults return false positives, meaning the test says there's a problem, when there really isn't. And once that false flag goes up, it often leads to angiograms, stents, or even bypass surgery, procedures that carry real risks and often no proven benefit in people without severe symptoms. A major study published in JAMA Cardiology found that more than half of all stents placed after stress tests were unnecessary. Those patients had no real improvement in survival or quality of life. But what they did experience were complications: bleeding, contrast dye reactions, and longer hospital stays. Let me tell you about Raymond, a 75-year-old retired postman. He was healthy, walked every day, and only mentioned feeling a little tired when going uphill. Just to be safe, his doctor ordered a stress test. The results were unclear, so Raymond was sent for a catheterization, a tube threaded through his artery to look for blockages. A minor narrowing was found. A stent was placed. But that same night, Raymond had a bad reaction to the contrast dye and ended up with kidney problems. He spent nearly a week in the hospital, and when he came home, he still felt just as tired. You see, Raymond didn't need a stent. He just needed better hydration, more rest, and maybe some adjustments to his daily routine. If you're over 70 and not experiencing clear cardiac symptoms, like chest pain during activity, shortness of breath while walking, or a sudden drop in stamina, then a stress test might not be the answer. So what's a better option? A simple resting EKG can check your heart rhythm without pushing your body too hard. Or a coronary calcium scan, a low radiation test that looks for dangerous plaque buildup and gives a clearer risk picture. Bottom line, just because a test is common doesn't mean it's harmless. Ask your doctor, what happens next if this test is positive? If the answer is unclear, or leads straight to a risky procedure, it might be time to pause and explore safer alternatives. Now this next one might really surprise you. We've all been told that colonoscopies are essential, life-saving even. And for many adults in their 50s or 60s, that's absolutely true. But what if you're over 70 or even 75 and feeling just fine? Here's what most people don't know. At that age, a routine colonoscopy may carry more risk than benefit. Yes, colonoscopies are designed to detect colon cancer. But as we age, the prep process becomes much harder on the body. Strong laxatives can cause dehydration, dizziness, or even kidney problems. And the sedation used during the procedure? It can interfere with brain function, especially in older adults, sometimes leading to confusion or memory issues that linger. But it gets more serious. The colonoscopy itself, while usually safe, can cause bleeding, tearing, or even dangerous heart rhythm problems in some seniors. A massive study looked at over 1.3 million Medicare patients aged 70 and older, and found something eye-opening. For every 1,000 colonoscopies done in patients over 75, only 2 lives were saved, but more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Let that sink in. Let me tell you about Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no family history, and had already had 2 clean colonoscopies in her lifetime. But her new doctor, eager and fresh out of training, pushed her to do another, just to be safe. During the procedure, they found a small polyp and removed it. That night, Dana was in severe pain. She fainted. At the hospital, they discovered a bowel perforation. She spent 9 days recovering and lost weight, energy, and confidence. Her life changed over a test she didn't really need. So what should you do instead? If you're over 75 and feeling well, most experts, including the U.S. Preventive Services Task Force, recommend stopping routine colon cancer screening. If you still want to stay cautious, there's a much safer alternative, the FIT test. It's a simple, non-invasive stool test you can do at home. No prep, no sedation, and it still catches most concerning cases. Remember, not every test is about adding years to your life. Some are about protecting the quality of the years you already have. So if you're past 70, ask your doctor, is this test really necessary for me? And if the answer is routine, not urgent, maybe it's time to consider a safer path. Alright, we've come to the most overused, most dangerous, and most misleading test on this entire list. And chances are, you've either had it offered to you or seen it marketed as premium preventive care. I'm talking about the full-body CT scan. These scans are often sold as part of executive health packages or peace-of-mind services in private clinics. The pitch is tempting. Catch cancer early, see everything at once, stay one step ahead. But here's the problem. The science doesn't back it up. A full-body CT scan exposes your body to 10 to 20 millisieverts of ionizing radiation. That's the equivalent of getting 500 chest x-rays in one sitting. And when you're over 70, that kind of exposure isn't just risky. It can actually become a cause of cancer, not a cure. According to a 2023 modeling study published in JAMA Internal Medicine, the rise of these scans may now be responsible for up to 5% of all cancer cases in the US. That's right, -1 in every 20 cancers could be triggered by a test that was supposed to prevent it. And it doesn't stop there. The scan often picks up tiny, harmless things, a little nodule here, a calcification there, that are completely normal signs of aging. But once those show up on a report, the machine starts turning. Follow-up scans, referrals to specialists, biopsies, surgeries, and worst of all, fear. Let me tell you about Marcus, an active 80-year-old who used to teach martial arts to other seniors. He felt great. No symptoms. But he signed up for an elite health screening at a private clinic. His scan showed a small 3 mm nodule in his lung. The clinic referred him to oncology. He got a PET scan, then a needle biopsy. The result? Benign, just a harmless age-related change. But the biopsy caused a lung collapse, and Marcus spent 2 months recovering in the hospital. All for something that never needed to be touched. Experts are now crystal clear. Full-body CT scans should not be used to screen healthy adults without symptoms. The American College of Radiology advises against it. The risks outweigh the benefits every single time. So what should you do instead? If you feel fine, stick with regular checkups from your primary care doctor. Pay attention to your body. If you start to notice real symptoms, like unexplained weight loss, a persistent cough, or swelling, that's when targeted imaging makes sense. But doing a full-body scan without any red flags? That's like searching for treasure with a landmine detector. You might find something small, but the damage from digging it up could be far worse than leaving it alone. Your health is precious. Your time and energy are valuable. Don't trade them for fear-driven testing that can take more than it gives. So there you have it. 5 routine health checkups that may seem helpful, but can actually harm, especially once you're past 70. Now let's be clear. This isn't about avoiding medical care. Modern medicine has saved millions of lives. But it's not perfect, and more testing doesn't always mean better health. We've seen how these tests, bone scans, brain MR, stress tests, colonoscopies, and full-body CT scans, can sometimes create more problems than they solve. From unnecessary medications and procedures to fear, side effects, and even life-threatening complications. It's clear, sometimes less is more. And that's the big takeaway here. Once you hit your 70s, The smartest path forward often isn't another test. It's a stronger focus on lifestyle. That means staying active, eating well, getting quality sleep, connecting with others, and listening to your body. And before saying yes to any scan or procedure, ask the question we keep coming back to. What happens next if this test finds something? If the answer leads down a road of more tests, invasive treatments, or vague risks without clear benefit, it might be because real prevention? It isn't found in a machine, it's in how you live every single day. Now we'd love to hear from you. Have you, or someone you love, ever had a medical test or treatment that turned out to be unnecessary? What happened? How did it affect your life? Share your story in the comments. We read every one, and your experience might help someone else make a wiser choice. If you found this video helpful, give it a like, and hit subscribe for more practical science-backed tips made specifically for older adults who want to live better, not just longer. Thanks so much for watching. Stay strong, stay smart, and most importantly, stay in charge of your health.